If you go to a drugstore, Costco, or even Amazon, there are so many different types of pain medications. How do you know which one to choose? Do you just choose based on the Amazon ratings? Well, today you're in luck. We're going to be going over the most popular topical pain medications to help you make a better decision for which one might be best for you. Because the last thing I want is for you to spend money on something that might not even help you. For example, one of the top search results that shows up when you type in topical pain relief creams on Amazon contains an active ingredient of histamine dihydrochloride.
What?
I'm so confused. In all my years of medical training, residency, and working in pain clinics, I've never seen anyone use histamine for pain. What's even more interesting is that Wikipedia says that histamine dihydrochloride is FDA approved for pain, and yes, Wikipedia is not a valid resource for information. However, a lot of people use it. And when I checked the citation, it cited a paper from 1983. That's 40 years ago. I also checked the FDA website and there was no FDA approval for histamine dihydrochloride for pain. So interesting. Moral of the story, don't listen to everything that you see on the internet. Do your own research before making decisions. Now, there is one topical pain medication that I usually do recommend more often than others, so stay tuned for that. Also, I'm not sponsored or affiliated with any of these brands or products. This is just my honest opinion after reviewing research articles and years of medical training. However, this video is only for educational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. What is up, everyone? It's Everyday Jan. My channel is all about health and wealth and how to make every day yours. If you're new here, hit that subscribe button for more videos. Now, pain is a very broad, generalized term. There are so many different types of pain and so many different causes for pain. If your pain is from inflammation, for example, like an ankle sprain, then we want to use medications that are anti-inflammatories. Versus if your pain is from nerve pain, like sciatica or shingles, then we want to use pain medications that target the nerves. So when it comes to treating pain, the goal is to figure out first what is causing your pain and then using medications to target that. Let's talk about Tiger Balm. So I grew up in an Asian household, and if you're Asian and you're a millennial or even Gen X, you know exactly what Tiger Balm is and exactly what it smells like. For some reason, Asians love Tiger Balm. I mean, they use Tiger Balm for everything. Headache, Tiger Balm. Backache, Tiger Balm. Mosquito bite, Tiger Balm. Stomachache, Tiger Balm. So what's so good about Tiger Balm? I mean, it's been around forever. Its two main ingredients is camphor and menthol, and those together create a cooling effect that desensitizes the nerves and the pain receptors. And so Tiger Balm is good for alleviating muscle and joint pain. However, it's not my go-to medication because there are better ones. Salon Pas is another popular topical pain medication, and it comes in a patch form, and even Costco sells it. Now, it can be a little bit confusing because brands like Salon Pas create several different products that contain different ingredients. So you have to pay attention to see what ingredient is in that product. There are two main types of Salon Pas. The original Salon Pas contains ingredients that are similar to Tiger Balm. So it has camphor, menthol, and it also has menthol salicylate. So again, you'll have that cooling sensation. Salon Pas also creates another product that contains lidocaine 4%. If you don't know what lidocaine is, it's a numbing medication. It's the same medicine that they use that if you go to your dentist and you get a procedure done and they numb you up, they're usually using lidocaine or something in the same class. Lidocaine blocks nerve pain transmission, so that's why you feel numb and that's why it works for pain. Now, lidocaine 4% is over the counter and you can buy it anywhere. Now, they also have lidocaine 5%, which is 1% stronger, but usually it's prescription only and most insurances don't cover it. Lidocaine 5% is FDA approved for post-herpetic neuralgia, which is just basically pain from shingles. And it has been shown to be effective and safe in nerve pain like diabetic peripheral neuropathy, carpal tunnel syndrome, and even chronic low back pain, as well as degenerative joint disease like arthritis. In practice, we often recommend a lidocaine patch for things like back pain because it is much safer and has less side effects compared to oral pain medications. Because lidocaine usually comes in a patch form, I think it's great for larger flat surfaces like your back or your neck that might be harder to reach areas, but you can use it on joints like knees and shoulders as well. Aspercreme is similar to Salon Pas like we were talking about before because it contains 4% lidocaine, but it's in a cream form. So it's easier to apply on elbows, knees, shoulders, and joints like that. And again, because it's lidocaine, it works by numbing the nerves. Penetrex is also another very popular product on Amazon. I mean, it has 62,000 reviews on Amazon. What makes Penetrex so great? Penetrex has 3 main ingredients that they advertise. The first is arnica. Arnica is from a plant and it's been used in pain after surgeries as well as osteoarthritis. Now there have been several studies done on arnica and the results have been mixed. The next ingredient is vitamin B6. Now the Penetrex website says that vitamin B6 is used to provide relief from discomfort associated with repetitive muscle use. Now I looked into this and I couldn't actually find any research articles that supported this, so if anybody knows, let me know. Vitamin B6 is sometimes used in cardiovascular disease, PMS, and nausea and vomiting in pregnancy, aka morning sickness. But I've never actually seen anybody use vitamin B6 in pain from muscles and joints. So honestly, I'm not sure where Penetrex is getting this from. Also, getting vitamin B6 into our diet is not hard because B6 is in a lot of the foods that we eat. For example, B6 is in chicken, fish, bananas, potatoes, spinach, and even cereal. Now the next ingredient that Penetrex has is MSM. MSM is believed to reduce pain from degenerative joint disease and muscle soreness through anti-inflammatory effects. Overall, Penetrex does have ingredients that are anti-inflammatory that can help reduce pain, and it has very minimal adverse effects. I think it's worth trying. I mean, I've used it myself. It's easy to apply, and they have different products like this roll-on one and also this cream form. There's no scent, which is nice. But given the mixed results from the studies that have been done, it's not my go-to topical pain medication. Capsaicin is another one that we sometimes recommend for pain. It's made from hot chili peppers, so it has a hot burning effect. Normally, we recommend capsaicin of 0.025%, but they do make stronger ones of 0.1%. However, be careful with those 0.1% ones because the higher percentage means that it really has a lot of that hot burning effect. Make sure you wash your hands after applying capsaicin and do not rub your eyes because that can really burn your eyes and be very uncomfortable. Capsaicin works by decreasing something that's called substance P, which then decreases the pain sensation. However, it can take several weeks to work into full effect, so be patient with it. Most often, it's used in nerve pain, osteoarthritis, and chronic musculoskeletal pain. Now let's talk about Voltaren Gel, which consists of diclofenac. Diclofenac is an NSAID, like Advil and Aleve, but this one is in a cream form. This is one of the most common topical pain medications that I do recommend because it has been well studied and has been shown to reduce inflammation in conditions like osteoarthritis and overuse muscle and tendon injuries. In the United States, it previously was prescription only, but in 2020, the FDA has approved this for over-the-counter use, so you can buy it from anywhere like Costco or Amazon. And the FDA has approved it for use in hand and knee arthritis. Because it is a topical NSAID, it's easy to apply on joints like your shoulder or your knee or your hand or wrist. And there has been a study that has shown that it does penetrate the knee joint. Because it is a topical NSAID, it has a much less chance for having systemic side effects. So people who can't tolerate oral NSAIDs, like if you have stomach ulcers, kidney disease, or heart disease, then this topical NSAID is a potential alternative. However, if you have these conditions, be sure to discuss it with your own doctor. Now let's talk about CBD, because there has been a lot of interest in CBD for pain lately. Now there's a difference between THC versus CBD. THC is the psychoactive component in marijuana, and it's what causes that high euphoric feeling that people say when they smoke weed. On the other hand, CBD does not produce that feeling. However, regulations for CBD vary worldwide and even vary state to state. It is a potential alternative to opioid medications. However, it is still understudied and there are limited clinical trials. Some studies have shown that it does improve chronic pain, quality of life, and sleep quality. However, it is not enough evidence to make a proper recommendation. There are some other popular topical pain medications like Bengay, Biofreeze, and IceyHot, and traditionally most of those have menthol, so again that produces that cooling effect to help with pain. Bengay and IceyHot have also expanded their product line, so they also do have some products that have lidocaine 4%. When you are looking at these products, make sure to check the back at the ingredients. Look at how much percentage they have. For example, when you look at Bengay versus Biofreeze versus IceyHot, they have different percentages of menthol. Blue Emu is also a popular one. Now, Blue Emu also has different products, but the original Blue Emu consists of emu oil, which is high in fatty acids and functions as a carrier oil to bring the ingredients into the skin. It also has aloe vera, which is for soothing effects, not really for pain, MSM, which reduces inflammation, and it also has glucosamine, which have mixed studies. It does have great reviews on Amazon, and I do know one person who swears by it. I tried it myself, and I think it's okay. Overall, diclofenac or Voltaren Gel is my go-to medication when it comes to treating pain from arthritis. Lidocaine 4%, which is in Salon Pas and also Aspercreme, is another great option, which works by causing a numbing effect. Menthol and capsaicin are my second line topical medications for pain. They both work, and it really just depends on whether you want that cooling effect that menthol has versus whether you want that burning effect that capsaicin has. Both are great options. Now, there's nothing wrong with the other medications, and the good thing about these topical pain medications is that they have very little side effects. So you can try it out and see if it works for you. Again, this is not medical advice, so be sure to talk to your own doctor regarding your pain issues. All right, I hope that video was helpful for you guys. Don't forget to like and subscribe, and I'll see you guys next time. Bye for now.